Yeah, thank you so much for inviting me to speak today. I want to tell you, jump straight into what I was trying to say today to reboot the economy after COVID. That in 1918, the Spanish flu, if you look at these pictures, is very similar to what's happening today. There were masks, there were quarantine, there was work at home, and even there were respirators. So for a century, our response to pandemics has not changed. But today, India is rebooting again. If you remember during the terrorist attack that we had in Mumbai city, the questions were the same. What were the results? What were the answers? And everybody was asking, how did this happen? And would we be able to recover? But today that is a distant memory, and we hope that that will be true of COVID soon. We all, today the minister talked about Amitabh Bachchan. In this case, I think the enemy is invisible and usko pakadna mushkil hai. And that is the real essence of the pandemic. If you look at this chart, on the left of this graph, it shows that the great transmission is happening when a patient doesn't have any symptoms. So how do you know that he's transmitting the virus or he's not transmitting the virus? Today morning's news was an example. They said Abhishek Bachchan went to a dubbing studio with just one other person or something like that. And you're not to know whether the virus is sitting on a surface over there. And actually, after you get the symptoms, the transmission is lower. India's mortality rate, as the minister mentioned, is much lower, though our numbers are steeply climbing higher. I think the real differentiator is the leadership. And if we have good leadership, how Kerala contained COVID in 100 days, and yet we find many public health institutions not even, the posts are vacant in medical education or in public health departments, which are so critical in this crisis. Angela Merkel, for example, is one of the few women leaders who has lowered the transmission by sheer good management, playing to Germany's strengths of equipment and really being, maybe as they say, doomed to lead. But she's leading the world in Germany of how the response can be better with good leadership. My colleague at the Harvard School of Public Health, Dr. Lipsitch, who's one of the best known epidemiologists, said it's going to be like waves, not really just one big curve coming down. And there'll be peaks and valleys, and then there'll be waves in the fall in the US or in cold weather in parts of North India. And so we are not going to see the end of it very quickly. We're going to go on maybe for a few years. So then what is a regimen for reopening? One example is that Atul Gawande is a very famous surgeon. He worked with 75,000 doctors in Mass Brigham, which is a hospital in Boston. And he said there's a 5-part strategy. There are 4 pillars, hygiene, distancing, screening, and masks. But the 5th element is very important, and that is culture. And the transmission rate for all these doctors has been extremely low. And he's the author of the book Checklist, and how do you do a checklist in this 5-part public health plan. It is a fundamental and moral imperative, and I just want to briefly go through that. So the hygiene, screening, distancing, mask, culture, we've all heard about it. But if you skip one, the treatment won't work. It's like a cocktail, and you have to do it together. We need to understand their strengths and limitations if we want to reboot the economy. We know that now the symptoms are not just fever, sinus pain, and cough, or an altered sense of smell. There's a much wider array of symptoms that you can see every day. Start with hygiene. When you wash hands, and you've heard about it, increase in sales of soaps and things, but frequency makes a big difference. If you wash your hands 10 times a day, the frequency is down by 90% or so. If you do it 5 times a day, it's 45%. And if you do it every time you meet 3 people or more, then you will have a very, very low transmission. So a group environment is something where you could wash your hands before and after. So simple to do. Social distancing, we've heard everybody saying, should it be 3 feet or 6 feet? And right now, the science is saying it's about 6 feet. It is now even transmitting in air through ventilators. So we have to be even more careful than ever before. Auditoriums and closed spaces, you know, there was a choir in Washington. They were singing loudly, and God knows whether that happened yesterday in the dubbing studio, where you were singing or speaking loudly, and that transmits the virus. A mask, there is an overwhelming evidence of the benefit of mandatory masks. Luckily, in our country, we are all in one party thinking that mask is important. In the US, there is a divide between the Republicans and the Democrats on whether masks are effective. Today's picture with Donald Trump wearing the mask for the first time, I thought is riveting, because masks now, there is really good scientific evidence saying that masks are important. N95 masks are useful for the healthcare community and not really for every person. So we all started looking like monkeys, but really masks are very vital. Culture is arguably the most difficult pillar of this new combination therapy. People tend to focus on 2 desires, safety and freedom. Keep me safe and leave me alone. My staff at home, when I'm not looking, will pull down their mask, keep it below their nose and do their work. Even when they're sweeping the floor, having a plastic thing will stop aerosols, will be pushed up. So how do you train people about culture and doing it all the time? Training people at work, at home. Culture and changing behavior is perhaps the most important thing. I believe that drug treatments are going to come faster than the vaccine, as there are 1,800 clinical trials around the world, and each one is trying to focus on different parts of the virus, sometimes killing it, sometimes treating the cytokine storm that you can see in this picture. That's what really kills the patient, and many, many drugs, including some of my own, are trying to beat this real piece in the puzzle. WHO did a very quick study on dexamethasone. It welcomes the preliminary results in the UK. You know that in the United Kingdom, in 1 month, they could recruit 5,000 patients. That was the fastest clinical trial I've ever seen. So this is what's happening. Scientists are collaborating, governments are working, and we are getting fast new drug approvals. 3 I've approved in the last week, 1 this morning. And so it's just going on very quickly that the regulators are acting. So the 5 weapons of Wuhan were social distancing, contact tracing, testing, isolation, and treatment. Remember that these began a century ago. So we know what to do. The question is, how do you implement it? We also know that this is not the first disease, which is called a zoonosis, that it jumped from animals to humans. We know that there are 100 diseases. 2 examples recently are swine flu and bird flu. One came from pigs, one came from birds. So that is a zoonosis. What we have to predict it, and we have to survive. That is going to be the new science. A mental health crisis have been really the telling feature of COVID in our country, I guess everywhere in the world. And the real, I would say the burden on young people, especially even school children, is quite a lot. What are the lessons of history? Should we have a democracy, or is a dictatorship better, just enforcing all the rules? It is proved, that democracy is a much better way of transmitting information quickly to public and getting communication sorted. The president of Harvard, my colleague at the Board of Overseers, said there are 4 crises: health crisis, a moral crisis of disparity of availability of treatment by gender, by race, by poverty, a financial crisis, and a leadership crisis. And for the first time, the world is experiencing all four together. And that, I think, prompts innovation, the fifth pillar that the minister mentioned. There are innovations in everything. We have a pop-up hospital, a cardboard bed like this, which can be made into 200 beds, inside a week. And so urban architecture, just all these ventilators of air conditioning, filters, UV systems, all improving to help us fight the virus. There are new ways of working. Over the summer, my mother wanted to make pickles, and she couldn't because of the lockdown. And here on the left is a picture of my cooks in PPEs, and then they made the pickle using mangoes, so she didn't lose her pickle. So I think this will be a new way of working in life. India has always underinvested in healthcare. At the time of independence, only 8% of the healthcare was private, the rest was public. Today, it is exactly the opposite. 75% is private and only 25% is public. So if you lock down the private healthcare, obviously the public healthcare is going to be overloaded. There aren't enough beds, or there's difficulty getting a bed, and things like that, which has been seen across cities in India. So if you lock it down, the major part of it, you will have this queue in the service. And I actually think that by releasing the lockdown, we will unlock the private healthcare. In Dharavi, just to prove my point, there's an army of GPs which helped Dharavi to beat COVID. Did this article mention the government or the BMC or other regulators? It was this private army of doctor entrepreneurs who opened up their clinics and really worked on the ground, knowing each of their patients really well. And therefore, this trend has been dipped. And so it is seen in other places as well. So, the lack of travel has really improved the skies, improved the train traffic, as the minister said, that you reach faster than ever before. So we must make our promises to COVID, be part of this appropriate behaviors. We don't want to be like the chicken who's cooked. We don't want to be in that position. And so we have to make 15 promises to ourselves, to our colleagues, to people at work. People don't wear masks when they feel they have a family member. People don't wear masks at work because you have a friend. People don't wear masks with a neighbor. And that is where we are really getting, COVID very easily transmitted by these kind of behaviors. And so living in this lockdown position, we all went, as the COVID virus is saying, I'm waiting for the end of the lockdown, me too, that this is going to be the big mountain to climb. You've seen the movie Sound of Music, and everybody's climbed every mountain. I think opening the lockdown, getting all this through and getting the doctor entrepreneurs to work, getting appropriate behaviors is going to be the key to really dealing with it. There's a talk about CHEENI kam KARO, but we know that most of our products, especially medicines, the APIs for many, many years come from China. We have been doing price control for far too long. When we cut the prices so much that Indian manufacturers can't make the drug. We used to be, my own company used to be the primary manufacturer of vitamin A. I remember going to the then minister and saying that if you cut it so much that we can't make it, everything will go to China. He said, no, price control for us is very important. So now we are first time, even minister said, that we are realizing that we can't do that and we have to build our own infrastructure. So pandemic proofing the planet, I think, is going to be a new business, perhaps, a new way, a new place of innovation. Predicting the surviving and all that is going to be a completely new normal. One of the things that Indian innovation, I just want to give one example. Somebody invented a UV light which is mobile, and it goes from room to room in your home or office. Because we know that the bacteria lies down on surfaces, and they invented this mobile unit. I was quite impressed with the idea, but you can't have a human there, so they have a long cord, and you put it into the room 5 minutes, and the room is sanitized. So I think Indians are very good at innovation, and they will continue to invent new things like this. Now, of course, we have to be very careful that we don't use sanitizers in the wrong places. This was a fire caused in a car in a Mumbai building. One of my beliefs is that there will be lower transmission after lockdown is over. Why is that? Because, as I mentioned, you will unlock all the 75% of private healthcare who are actually sitting at home because there are no patients in their clinics. And this will, as many cities have seen, have really lowered the transmission. Now, it is not true in those states of America like Arizona, where they didn't allow masks to be worn. It is, remember the 5 cocktail drugs that I said that they have to be done together. You miss one and it won't work. And so this chart is actually for people who actually did everything correctly and gave them something to smile about. To end, I just want to say what the Piramal Foundation, of which I'm the director, did in the lockdown, which was again innovative and using no-touch processes. We work in health, education, and water. And one of the big things that we did in the first 3 weeks or so to make sure that thousands of people were fed. It is part of Indian culture, very strong part of Indian philosophy. And then we did an outreach, contact tracing, for people helping the government in distant areas like Assam, Nagaland, where we know health facilities are very poor. And then even in tribal areas to get children and mothers safely to deliver their children and have very low infant and maternal mortality. One of the things that I'm most proud of is the 35,000 volunteer program, which is protecting Nani, Nana, Dadi, Dada, older people in the 100 aspirational districts, the most backward, the most poor districts, all being run by young people. They're doing, calls and then calling grandparents, telling them where the facilities are and what to do to protect themselves. And so this is something which anybody can do. All young people can come in and really do and make a difference and really apply every knowledge we have. One of the things that really is the flip side of the good parts that Minister said that, I'm being more efficient, I'm inside my office, I'm doing more, we are all sitting at home. But I think the loss of education of a girl child is the most heartbreaking part of COVID, where children will not go to school. And how can we make sure that using technology, we are able to make sure that the girl child is not lost to education. And therefore, with these methods, aspirational districts are faring very well in containing the infection, despite lack of medical facilities. In water, we are cleaning nearly 2 crore liters of water because we know that water is very helpful in preventing infectious disease. So I really want to wait for the day when Amir Khan again says all is well, all is well. And there's a U-shaped curve, like this U with a doctor pulling reins. And I wanted to give you a public health perspective. And the minister gave a very nice economic perspective. But we wanted to re-emphasize that public health really matters at this time. Thank you.
Thank you.
Thank you so much. Take any questions. It's lunchtime and it's quite...
Yeah. Ma'am, our Senior Vice President Sanjali Bansal would ask the question. Anjali, please go ahead.
Thank you. Thank you so much for such a excellent, again, I think very thoughtful, very insightful, and as always with you, very informative. You made us think about so many different things, and I'm struggling to kind of select questions here. But going from COVID, its response, your insight on this 5-part plan, insights from the Harvard School of Public Health, the point around changing culture and habits as we live and we work. The fact that you believe that drugs will come before the vaccine, 1,800 clinical trials around the world, very encouraging also. And absolutely yeoman, sort of inspirational work done by Piramal Foundation. I must say, I am personally particularly touched by the fact that you mentioned the risk to education of the girl child, because we cannot lose the momentum that has been so hard won on keeping our girls in school and promoting literacy and education of the girl children. So with that, let me jump into a couple of questions. One is actually around public health, as you mentioned. And public health infrastructure in India, to some extent, actually has not kept pace. For us to be an aspirational economy, ease of doing business, where is the access to good public health? So in your view, what will it take for us to really take pride as a developed country, $10 trillion economy, as we are aiming to be on the economic front, to create this infrastructure for access to high quality public health? Is it a public-private partnership? Yeah. Where will the investment come from?
Yeah, Anjali, so Amitabh Kant was on another panel at Harvard with me, and when he said that we should invest 5% of GDP in public health and health, I almost jumped for joy, and most of my colleagues said, this is not just music, it's an orchestra. Because we haven't invested at all in public health. We didn't think it was important. And till now, we understand how much burden the public institutions have to take. And we can't unlock the private institutions. So how do you get this balance? And I actually think that it is investment in healthcare, in understanding its importance. Doctors, Amitabh Bachchan said it so nicely in a little video. He said that, doctors should have respect. Before, we were battling for violence against doctors. So we can't treat our frontline soldiers, people who are giving their lives for other patients and for their colleagues. I think we have to treat them well. We have to pay them. We have to make sure they have the proper equipment. We have to make sure they have the training. And do everything that we can. Don't we train the Indian Army? We do. So, and don't we give them guns and uniforms and everything to climb the Siachen glacier? We do. So we have to do the same thing with doctors and medical personnel.
So what will it take to promote more investment? One is, of course, the government. How should industry play its role in investing? Not just sort of in, as you know, I have a private equity type background as well. So PE finds healthcare and managed healthcare to be a good asset class. But that is not enough. That is still promoting only private health infrastructure. What is the role that industry, in your view, should play? Not could, but should play in actually creating large-scale public health infrastructure?
So I'll tell you my experiments with the Piramal Foundation, because we work in 12 states, we work across millions of people, and it's in public health on the ground. In Assam, I noticed that there's one area in Assam which has the maximum breast cancer in women. I couldn't figure that number. Why is it that in that, very serene atmosphere that so many women are suffering? And I started a mobile healthcare service to diagnose and treat patients. And it has to be with public-private partnerships. If we want scale, if we want investment, and if we want impact, you have to work with government. And foundations like that work with government, and they use technology, because we are good at using AI, we are good at doing pilot projects, and then we are good at ramping it up. So it has to be a public-private partnership. There's no other way to quickly get scale. You can't do it on your own. No one company can do on their own 1 billion people.
Absolutely. I think the point you've made around, if you want to create scaled impact, whether it is in education or healthcare, which actually is infrastructural for a country like ours. So it is the soft infrastructure. It is not enough to just do roads, ports, and bridges, but it is equally, if not more important, to create the education and health infrastructure. So absolutely working with government in a constructive, positive way. Let me switch a little bit to the point you made around technology. And India is a great hub for technology. We have an extremely vibrant, robust startup ecosystem. I'm sure you see a lot from your perch on what is happening with the AI, ML, artificial intelligence, analytics, big data-led health tech that is emerging. And what is the role that could actually play in partnering with large companies as well as with government in creating this affordable, accessible public health? The use of technology, innovation, startups.
So our foundation just signed an agreement with Rockefeller Foundation. They were the oldest public health institution in America where they treated hookworm disease a century ago. But now they have moved to doing AI in public health. And I thought that was fascinating, that how can we use AI to look at, public health. I mean, why is it very simply, can I analyze, the X-rays of thousands of women and just quickly detect where a person would be doing it one by one by one by one. This would just, in minutes, tell me where the problems are. So I think AI and machine learning are the tools of the future. And investing them in public health, I think, will make the biggest impact. And therefore, Bill and Melinda Gates Foundation, Rockefeller Foundation, these are some of our partners where we use big data and artificial intelligence on the ground.
Excellent.
We certainly look at Piramal Foundation as a role model for all the work that we do with Niti Aayog, for example, and really thriving public-private partnerships. So thank you so much. I will turn over.
Anjali, just one quick comment there. The corporates for change. This is one thing where we can all come together with what we are doing, because all of us are doing good. If we can get together, that also should have a multiplier effect. So we look forward to your suggestion and help even in that regard. Thank you.
That's great. We have a specific to-do coming out of this. So
always with me.
always. And there are multiple requests. If you could share your presentation, please. It's so I will quote. It's very educative. Is it possible to get a copy so we can share it with other people and spread awareness of how to sort of reduce the spread of COVID?
Sure. Before you go, I just want to say that there's a story of Hanuman jumping over to Lanka, and then he stopped on the mountain and to rest, and the mountain was done by the Lord of the Sea, Sagar, and that was done in gratitude of what Ram's grandfather or ancestor had done to have the sea form. And so today I agreed because of that gratitude. When I was president of ASSOCHAM, I had called on your then president and said, would you please support me in some of these changes that I want to do? One of them was having a lot more women. So, they did support me in everything and all the way, modern chamber should function. And I really came after a 10-year long wait to give gratitude for that. Thank you.
Thank you so